Hello, my name's Hannah Coman, and I'm a clinical psychologist here at Salisbury Hospital, and I'm going to be doing the sleep webinar with you today. Okay, so we're going to be thinking about the reasons that we sleep, the types of sleep that we have. We're going to think a little bit about the circadian rhythm or our body clock and what that is. We'll think about how much sleep we need, how cancer might affect our sleep, what happens to us if we don't sleep, we're not sleeping well, and what can we do about that? Okay, so why do we sleep? Well, we know that all living organisms have that period of rest or inactivity. So even plants and bacteria have that. So they don't go unconscious and you can't necessarily shake them awake. Of course, you can't, but they do have defined periods of being inactive and defined periods of being active. But insects actually do sleep. So bees, for example, will sleep for between 6 and 8 hours, and they will roll onto their sides and their antennae will become floppy. And other animals have made amazing adaptations to ensure that they can sleep safely. And so, for example, dolphins will sleep with half of their brain at one time. So they will literally close one eye and keep the other eye open, being able to keep that eye out for predators, but it also enables them to go to the surface and breathe every few minutes. And that leads us to wondering why does every living organism sleep in some way or other? And why have animals made these amazing adaptations throughout time to be able to sleep? Why not evolve not to sleep at all? And that points to sleep having some crucial function that over all of these years of evolution, nature hasn't been able to work out a way for us to do without. So if we think a little bit about what that function might be, well, one thing that we know is particularly important is for the prefrontal cortex, or the brain in general, to be able to rest, but particularly that prefrontal cortex, which is that blue shaded part on the picture there. And sleep is really the only time that that part of the brain can rest. And we know that that part of the brain is responsible for those higher order cognitions, or executive functions is the umbrella term that's used to describe that. And it includes things like mental flexibility, inhibition, working memory. And that looks like things like decision making or planning or problem solving. There's also a really important role in self-regulation, including emotional regulation, and a really important role in memory. We have different types of sleep, and I'm going to explain a little bit about those so that later on, when we're thinking about ways that we can help ourselves to sleep better, we can understand why those things might work. Okay, so we have two different types of sleep, which are REM and NREM. So REM is rapid eye movement sleep, and non-REM is non-rapid eye movement sleep. And we measure these types of sleep by measuring our brain waves with electroencephalograms, or EEG recordings. And we know that they serve different functions. We also go through different stages of non-REM sleep throughout the night, stages 1 to 4, and have REM sleep in between sleep cycles. So stages 1 and 2 are made up of lighter or small wave sleep, and stages 3 and 4 is that deeper sleep, that slow wave sleep. Okay, and we can see from looking at the picture there that we have more deep sleep at the beginning of the night, in those early hours of sleep, and as we move through the night, we're having less deep sleep and more lighter sleep and more REM sleep. So we're now going to think a little bit about the circadian rhythm, or our body clock, and what that is. So the circadian rhythm regulates different body systems, including our sleep-wake cycle. It keeps time by registering cues from the environment, so things like daylight, other light, and things that you're doing, so your behaviour. Our body temperature is really closely linked to our sleep-wake cycle, which again is important to know later on when we're thinking about things that might help us to sleep a bit better. So our daily lowest body temperature occurs between 2 and 6 a.m. It's that time of day where we're really likely to be asleep. And our highest body temperature is between 6 and 8 p.m. And that change can be as much as 0.7 degrees from peak to trough throughout the day. And actually, with or without sleep, that will remain fairly stable. But a drop in temperature helps the body know that it's getting ready for sleep. In the circadian rhythm and our sleep-wake cycle, we have a natural post-lunch dip, and again, a drop in temperature goes alongside that, as we actually evolved to have 2 sleeps. Another thing that might be helpful to know is that circadian rhythm takes 10 days to adjust to any changes. So that's really important if you might be a shift worker or you might be traveling, but also perhaps if you're having treatment and having to travel for treatment, or your bedtime has changed because of illness or treatment, or your getting up time has changed, that actually it might be more difficult to sleep for that reason, and it just takes that little bit of time, that 10 days, for your body to adjust to that change in your sleep-wake cycle. So how much sleep do we actually need? Well, there have been studies in the UK over a period of 40 years, and they've shown that the average amount of sleep that adults up to the age of 70 needs is between 7 and 7.5 hours. Actually, when we have much more than 7.5 hours, the benefit is very limited, so there's not much increase in daytime alertness at all. We also know that we need 5 hours of core sleep, that kind of deeper sleep, and if we're not getting that regularly and consistently, it might risk our immune system. But these studies are all based on people who are not unwell. So what about when we're ill, or if we're recovering from something like a surgery or treatment? Well, there's no specific recommended duration for those times, but it is really likely you'll need more sleep than usual. And I would say generally, let your body guide you at these times. If you need more sleep and you can sleep, then sleep. Okay, so thinking a bit more specifically now about cancer and sleep, we know from studies that over half of cancer patients report poor sleep quality and poor sleep efficiency, and that sleep might be affected by lots of different factors. So that might include pain, it might include hormonal changes, all of the different medications that people have to take will affect how well they're sleeping. We also know that there's a really strong relationship between sleep and anxiety, and of course it's understandable that during times of cancer diagnosis or treatment, the anxiety will be higher. Low mood as well, we know, has a relationship with poor sleep, and of course it might be likely that people are experiencing lower mood. Anxiety and lower mood can create that vicious cycle with sleep, where because of the anxiety or the low mood, sleep is poorer, and then poor sleep feeds into those two things. It raises anxiety levels and it lowers mood, creating those vicious cycles. Fatigue also impacts how well people are sleeping. Some might be finding it really hard to do things in the day, which then make it really difficult to sleep at night because they're less active, which is a really tricky, again, vicious cycle. People also report increased toilet needs during times of cancer treatments, or due to their specific cancer diagnosis, which of course gets them up in the night and makes it more difficult to go back to sleep. And feeling hot is really commonly reported. We also know that from different studies that patients may not always mention their sleep difficulties. I wonder whether that's because they perhaps don't consider them to be important, or they may just consider them to be expected and kind of part and parcel of it under the circumstances. We know that doctors may not actually ask specific questions about sleep difficulties as well. One particular study found that over 3/4 of patients assume that their sleep problems are caused by the cancer itself, and over half of the patients assume that doctors can't help them. So it's quite understandable that they wouldn't mention those difficulties and wouldn't then get the help. So now, how might a lack of sleep make you feel? Well, of course, it can lead to an increase in sleepiness, which feels like itchy eyes, eyes burning, and blurred vision. It can also lead to emotional changes, so things like being more irritable, more suspicious, more emotionally reactive, more sensitive to things. And as we talked about before, it can create those vicious cycles with anxiety and low mood. We talked earlier as well about executive functioning, and we know that sleep is really critical for the executive functions. So if we're not sleeping well, we might see that playing out in things like our ability to make decisions or problem solve or plan, or to be flexible in our thinking and to regulate ourselves or inhibit certain things that we're saying or doing. You can also get increases in suggestibility, and over long periods of sleep deprivation, people report misperceptions, which can actually mimic hallucinations and psychosis. So seeing things or not knowing what things are real anymore. So things really bizarre things reported, like seeing things moving or thinking they've seen hair in their milk, which goes to show the importance of sleep, that the effect it can have over time when people aren't getting enough sleep. And as I mentioned earlier as well, we know that consistent poor sleep can have an impact on the immune system. So what can we do if we're having poor sleep? Well, I mentioned earlier about the body clock, so we can really help that body clock out by understanding it. So we know that it takes cues from its environment, and one of the most important things for our body clock is to keep regular sleep times. So going to bed and getting up at the same time each day is really important, and in particular that fixed getting up time is the most important. Now there's always lots of questions about whether we should be napping or whether we shouldn't be napping. So napping is okay. As I said, we evolved actually to have 2 sleeps, so taking advantage of that and knowing that that second sleep would have been a post-lunch sleep, so after 2 p.m. usually. But also we don't want to be sleeping too late, because then it can impact on our nighttime sleep. So sleeping somewhere between the hours of 2 p.m. and 5 p.m. again going to give us the biggest success with that. We also don't want to sleep for too long, so we know that naps of between 20 to 30 minutes are the most beneficial for then increasing alertness. If we go on a nap longer than that, which may be tempting, we send ourselves into a deeper sleep. If you think about those sleep cycles we saw earlier on, we will go into a deeper sleep, and when we wake up, when our alarm goes off 1 hour later, we feel groggy and worse than we did before we had the nap, because we've woken up from that deep sleep. But of course, again, if it's a time of treatment or a time of feeling unwell, I would let your body guide you, and don't worry about that rule of thumb. Just do whatever you need to do. It's really important as well to consider the basics, which can be really easy to forget. So things like whether the bed is actually comfortable, and the lighting in your bedroom, but also the temperature. So I mentioned earlier on that our temperature is really closely linked with our sleep-wake cycle, and this is where that's really important. So we will sleep better in cooler environments, but not too cold. We certainly don't want the room to be too warm, because when our body temperature then starts to rise, it will think it's time to wake up, and we'll find it difficult to get back to sleep again. So things like thinking about what you're wearing in bed can impact that. So wearing synthetic materials will trap more heat, so that's not going to be as good as wearing things like cotton. It can actually be helpful to have a warm bath or shower before bed, which sounds like it might not be helpful, but what that does is it dilates our blood vessels and mimics that, then causes us to lose body heat, so mimics that drop in temperature that goes alongside getting ready to go to sleep. So that can be really helpful. We also need to think about things that interfere with our sleep cycles. So as I showed you earlier, we go through these different stages of sleep, and different things like alcohol and caffeine can affect how we go through those stages of sleep. So lots of people might say, oh, I can have a drink before bed, it doesn't affect me. But what does happen is when the alcohol wears off, it makes us too alert and changes how we're going through those sleep stages and causes disruption to the sleep quality that we're getting. So generally avoiding alcohol in the 4 hours before going to bed. Caffeine, same sort of idea, so avoiding that 4 to 6 hours before bed. Again, lots of people say, oh, they drink so much of it, it doesn't affect them, but it will be affecting how they're travelling through those sleep stages and may cause them to wake up feeling unrefreshed. Okay, and also giving some thoughts to screens, which can stimulate the mind and wake it up more. And we also know that blue light is emitted by some electronic devices and light bulbs, and there's been lots and lots of research on that shows how it interferes with sleep cycles, because it slows down the release of melatonin. So thinking about whether we've got blue light settings switched on or off on our phones, or what electronic devices we're using, generally trying to avoid using them in, again, those couple of hours before bedtime. We also need to remember our body clock, remembering it takes cues from the environment and trying to help it out where we can. So if we create a bedtime routine, our body clock takes note from those cues and knows that it's time to be getting ready for sleep. So having a wind down time before bed is helpful for that. so 30 to 60 minutes before sleep time, doing things like reading or having a bath, but important to do the things that work for you and that you find helpful and relaxing. Keeping dimmer light conditions is a good idea. And as I mentioned, having those electronic devices turned off. Okay. We also want to strengthen the association between bed and sleep, again helping out that circadian rhythm, that sleep-wake cycle. So reserving the bed for sleep, not using the bedroom as a work room or a recreation room. If you're feeling unwell and understandably need to spend more time resting, if you can, try and spend time in another comfortable room and not the room where you normally sleep, and trying to avoid watching television in bed. But again, it's a really difficult time when you're unwell and having treatment, so also just do what works for you, and if you need to watch television in bed at those times, that's okay. We also need to give consideration to how our own thoughts and feelings can impact sleep. So we talked earlier on about the vicious cycle that anxiety and depression can have with sleep. So thinking about what tricky thoughts and feelings might show up in the night and what we might be able to do about that is really helpful. Putting the clock somewhere you can't see it is a really good idea, because clocks stimulate lots and lots of thoughts that are unhelpful about sleep. So things like, are we getting enough sleep? How much sleep we haven't had? What we've got to do the next day? How long we've been lying there? All of those thoughts start to come up when we can see our clocks. So popping it somewhere you can't see it, including your phone, is a better idea, so we can't see that time when we're trying to get back to sleep or trying to get to sleep. As I said, worries really like to show up in the night time, so it can be a good idea to deal with those before we try to go to sleep, so before it's night time. So in the daytime, if we try to set aside a time where we can write our worries down, then they're out of our brain and onto that paper. So keeping a worry diary or something like that can be really helpful. In the night time, if those worries are showing up, we can use some different techniques to try and get our brain away from the worries and onto something else. So something really simple like a mental distraction technique where you're thinking of different animals for each letter of the alphabet can be a good one. Or it doesn't have to be animals, it could be anything that interests you. So something that engages you enough that you'll want to do the exercise, but it is a fairly boring activity and eventually your mind should wander and go back to sleep. Some simple breathing exercises can also be really helpful to calm that anxiety down, calming the body and enabling you to get back to sleep. So one that you can try is called rectangular breathing, and you can do this by either looking at a rectangle or picturing one in your mind. And as you follow the short side of a rectangle up, you take a shorter breath in, and then you follow the longer side of the rectangle across, taking a longer breath out, and then down the short side again, taking a shorter breath in, and along the bottom, taking a longer breath out. And you keep on doing that, so it's a longer breath out, a shorter breath in, a longer breath out, a shorter breath in. Okay, and if you're finding that you're having lots of worries in the nighttime or the daytime and really struggling with thoughts and feelings around cancer diagnosis or treatment, then it might be helpful to ask for a psychology referral so that we can help you with that in a bit more detail. Okay, if you've been trying all these things and you really can't sleep, or you've woken up and you've tried them and you can't get back to sleep, if it feels like it's been a little while, around 20 minutes, leave the bedroom, okay, and do a light activity that's not too stimulating, such as reading, and return to bed after it's been about 15 to 30 minutes. And again, that's about keeping that association with the bedroom and sleep. So you don't want it to be a place that your body is used to lying there, being unable to sleep. During that time, try not to do anything stimulating, anything that's going to wake you up more. So don't do anything with screens or start doing any work or something active like hoovering, because all that's going to do is wake you up more. Okay, so that's coming to the end of the sleep webinar now, so thank you very much for listening. I've just got some resources here, different cancer charities that might be useful for you. You can come back and have a look at what these are. And then we've got some specific sleep resources. So if you Google NHS sleep problems, Every Mind Matters, it comes up with a 6-week sleep program that you can access by email. It's also got information and videos on there. There's also an app called Sleepio, which is free on the NHS and might be helpful to some people. Okay, and also remembering your cancer support team who are there to help you out, and their phone number's up on the screen there, and they can give you any further advice or point you in the right direction if you need any more specific help. So thank you very much for listening.